a partial declaratory judgment ruling that Judge Scudder entered below. We had a two-branch motion for declaratory judgment. She granted one branch, which was holding that certain language, and I'll just read from the transcript because I think it's a little more clear there. At 2523 in the transcript, or in the appendix, Judge Scudder stated at oral hearing, I'm going to agree with the interpretation that it's up to Chestnut Ridge Party to determine when stratum is, it says completed, but it should be depleted, and they can store gas. And again, that goes to the last line in the second paragraph. You know, this is a 2-page gas storage addendum, and you know, here we are. We spent almost 10 years briefing it and arguing about it and reading it, and there's one sentence that had never been really discussed or determined, and that is the sentence. Let me read it here. At the end of paragraph 3 on the second page of the addendum, it is understood that a well need not be drilled on the leased premises to permit the storage of gas, and it is agreed that lessee shall be the sole judge as to whether gas is being stored within the leased premises, and that its determination shall be final and conclusive. And at the hearing in October of 2019, Judge Scudder agreed with us that that means Chestnut Ridge as the lessee is the sole judge as to when gas is being stored, which means we can determine
Attorney now?
Yes.
Hello, everyone. It's Wednesday, January the 27th, and I'm sorry we're running a little late here. We've been meeting with the legislator and the leaders just, this morning on several really important issues on the up-and-coming session, and I appreciate all their great work that they're doing, and on behalf of all West Virginians, I want you to know that they're really working hard for you. But nevertheless, we have had 54 deaths since the last briefing on Monday, and it's slightly better. You know, we still hate like crazy the fact that it's 54. It's 54 too many, but we're getting better. We're getting better, and we just got to stay the course. And Albert Wright with WVU hospitals and their systems and everything, and the Hospital Association, for the state, mentioned, I think yesterday or the day before, the days are running together now, that we got to vaccinate our way out of this. Well, we clung to the fact that we kept trying to bridge ourselves to the vaccine. Well, we have bridged ourselves to the vaccine. We've lost 1,953 people in doing so that we can't forget. And now, as we go forward, we read 54 of those names or those people, that we've lost. The bridge was costly, was it not? We're at the vaccine now. The great Albert Wright says, we're going to vaccinate our way out of this. And he's right. He's right as he can be. Our 1900th death is a 70-year-old male from Berkeley County. Our 1901st death is an 84-year-old male from Mingo County. Our 1902nd death is an 80-year-old male from Kanawha County. Our 1903rd death is an 82-year-old male from Berkeley County. Our 1904th death is a 69-year-old female from Mercer County. Our 1905th death is a 78-year-old male from Greenbrier County. Our 1906th death is an 89-year-old female from Berkeley County. Our 1907th death is an 83-year-old female from Greenbrier County. Our 1908th death is an 83-year-old male from Raleigh County. Our 1909th death is a 78-year-old male from Jackson County. Our 1910th death is a 70-year-old male from Berkeley County. Our 1911th death is an 86-year-old male from Mercer County. Our 1912th death is a 73-year-old female from Kanawha County. Our 1913th death is an 80-year-old female from Fayette County. Our 1914th death is an 87-year-old female from Mercer County. Our 1915th death is a 74-year-old male from Monongahelia County. Our 1916th death is a 79-year-old male from Berkeley County. Our 1917th death is a 63-year-old male from Lincoln County. Our 1918th death is an 84-year-old female from Berkeley County. Our 1919th death is a 75-year-old female from Barber County. Our 1920th death is a 92-year-old female from Ohio County. Our 1921st death is a 76-year-old male from Morgan County. Our 1922nd death is an 81-year-old female from Taylor County. Our 1923rd death is a 65-year-old female from Mercer County. Our 1924th death is a 96-year-old female from Wood County. Our 1925th death is a 46-year-old male from Kanawha County. Our 1926th death is a 93-year-old female from Mercer County. Our 1927th death is a 77-year-old female from Monongahelia County. Our 1928th death is a 70-year-old female from Monongahelia County. Our 1929th death is an 85-year-old male from Doddridge County. Our 1930th death is a 77-year-old female from Wyoming County. Our 1931st death is an 86-year-old female from Mineral County. Our 1932nd death is a 70-year-old male from Hardy County. Our 1933rd death is a 91-year-old female from Brooke County. Our 1934th death is a 66-year-old male from Ohio County. Our 1935th death is a 69-year-old female from Cabell County. Our 1936 death is a 1936 death is an 83-year-old female from Mercer County. Our 1937th death is an 83-year-old female from Wood County. Our 1938th death is a 78-year-old male from Hampshire County. Our 1939th death is a 70-year-old female from Cabell County. Our 1940th death is a 68-year-old female from Mineral County. Our 1941st death is a 74-year-old male from Kanawha County. Our 1942nd death is a 57-year-old male from Kanawha County. Our 1943rd death is a 72-year-old male from Cabell County. Our 1944th death is an 81-year-old male from Mason County. Our 1945th death is a 77-year-old male from Berkeley County. Our 1946th death is a 72-year-old male from Nicholas County. Our 1947th death is a 76-year-old female from Hardy County. Our 1948th death is a 56-year-old female from Upshur County. Our 1949th death is a 65-year-old male from Raleigh County. Our 1950th death is an 85-year-old male from Logan County. Our 1951st death is a 74-year-old female from Mason County. Our 1952nd death is an 82-year-old female from Kanawha County. And our 1953rd death is an 87-year-old male from Kanawha County. I said a minute ago, the bridge costs an awful lot. The bridge to the vaccine that we've paid. We've paid for the bridge. Get your vaccines. Don't be silly and not get the vaccine. Please never let these people just become a number. Please keep them in your prayers. We have 797 new positive cases in the last 24 hours with our positivity rate at 6.03. Our cumulative rate is at 5.60. Our active cases are 23,571. The number of daily active cases in West Virginia has gone down now 11 straight days. That's good. Our recovered cases are 92,251. Put the graph up there, Jordan, please. Look at the top line. Look at the top graph. You see what we're doing here? You've got the recovered cases and the active cases. Recovered on the top, light blue, active on the bottom, dark blue. We want the bottom line to go down and the top line to go up. It's working and it's getting better. 11 straight days, the bottom line's gone down. That's good. 550 patients now hospitalized. That's not bad considering where we were. 137 in the ICU units. It's better. You know, from the standpoint of the RT number, we're at 0.92. Now we're 27th best in the nation. It bounces all over the place, but we're still under 1. And 42 out of our 50 states are now under 1. And that's really, really, really good. That means we're winning. Now, again, a reminder, if you're 65 and older and you get that sniffle or you get feeling the least bit bad, you have got to go get a test to where we can determine if you're positive or negative, and if you're positive, we'll get you the antibodies and we'll save your life if we can catch it quick enough. This week we're at 94.6 administered, into somebody's arm. To date, West Virginia has administered 171,325 doses of COVID on the first dose and 46,094 second doses. For a grand total, we have given shots to people in the state of West Virginia of 217,329. Now, did you hear that? We only have a population a little more than 1.7 million, and we have given 217,329 shots in people's arm. We're saving lives, and we need to just keep it going and keep it up. We keep screaming like crazy for more and more and more doses of vaccine. We did have a little glitch on the screen and everything. It's not a glitch, it's good. We got an additional 3,700, or we're notified we're going to get an additional 3,700 doses of Moderna next week, in addition to the Pfizer and the Moderna doses that we're getting anyway. Again, there's lots of reasons probably why we lead the nation in getting these vaccines in people's arms. But a great big part of that are our partners at the local and the county levels. You know, all of our counties and all of our community partners play such an important role in getting West Virginians vaccinated, and I thank all of them from the bottom of my heart. Yesterday, President Joe Biden announced the purchase of 200 million more vaccine doses and offered up an increased distribution to all states next week. He said they will increase overall weekly, to states with an additional 8.6 million doses to a minimum of 10 million doses. This is an increase of 1.4 million doses per week. The U.S. will buy 100 million more doses from Pfizer and 100 million more doses from Moderna. And both the companies are surely working on amping up more and more and more production. They also announced the Department of Health and Human Services will provide vaccine allocation estimates for the upcoming 3 weeks, as opposed to a 1-week look ahead that we've previously had. From the standpoint of our new vaccine scheduling system, all West Virginians can now pre-register to get their vaccines through the new scheduling system. Since we launched this, we've had more than 100,000 West Virginians get pre-registered. And I encourage all West Virginians to pre-register. It takes about 10 minutes to pull it off, not all day long on the phones. I hope to goodness that this is making our lives better, and we want to just continue to try to do any and everything we can, to be able to make things better. For those that don't want to go online, you can still call, and staff will put your information into the system for you. In regard to the Saving Our Wisdom clinics, the community vaccination clinics, as part of the Operation Save Our Wisdom, are open to West Virginians 65 and above. We do not have enough doses to go around to everybody. We're trying to do it by appointment only. As I stated earlier, we are holding 25 community vaccination events in 17 counties this week to serve the people that are 65 and above. Next week, we will have vaccine clinics in all 55 counties, and and this will surely help reach out to some of the more rural areas that we've had trouble getting to. So far, now get this. So far, we have put shots in arms on individuals 65 and above. 76,924 have gone in somebody's arm 65 and above. And the biggest thing that I tell you about that is when we pivoted right for our people, our wisdom, That's why we named it Save Our Wisdom. We pivoted at a time that people really that were 65 and above in the general public thought that they probably didn't have a chance in the world of getting that shot until April. But still, it's still January, and we have put shots in arms of 76,224 individuals that are 65 and above. And we're trying to get everybody. As far as our long-term care facilities, there have been 16,770 long-term care facility residents and 18,000 long-term care facility staff who have chosen to get vaccinated. That's good. That's great. For our teachers and service personnel, we have had 16,869 that have chosen to be vaccinated, and that's good too. Your COVID-19 vaccine info line is up. The vaccine reminders, you got to get 2 doses of the same one. It's either Pfizer or Moderna right now. Again, please, your best defense is this mask. And on top of all that and everything, just use your head and know that tens of thousands of people have been vaccinated. You can't get COVID from being vaccinated. Give blood. It will really help and everything. And in addition to that, just remember what I've said over and over and over. If you have that sniffle, headache, tired, anything, go get tested. Please go get tested. If you'll go get tested and God forbid, but you would come back positive, we got the antibodies so we can save your life. That's all there is to it. Your free testing maps are up on the board and everything. Your drive-through pharmacy people, Walgreens and Fruth, we really, really appreciate. The long-term care facilities, we have 85 outbreaks in our long-term care facilities. We only have 6 in our churches in 5 counties. That's Clay, Hampshire, Nicholas, Summers, and Wetzel counties. You've heard me about a pew in between you. Wear your mask in church if you're 65 plus and everything, and maybe you can get your services online. Just hang on just for a little bit more, just a little bit longer and everything. If we can get you those vaccines and everything, we can really pull the reins back on this terrible killer. We have 155 inmates and 40 staff that are out, that have COVID, have tested positive now, and now there are 0 cases, inmate cases in North Central. There were 49 on Monday. The inmate cases include 143 at Lakin, which is down from Monday, and 109 inmates are now recovered from Lakin, and the National Guard has begun the sanitizing. Wear your mask. Wear your mask. I'm out of breath yelling, wear your mask. Get your flu shots. Give blood. And now, I want to take time to just talk just a second. Well, I'm going to end up with that. I want to touch on this real quick. That we had an announcement yesterday, or day before yesterday rather, about a wind farm. And it's from Clearway. I think it was. Oh gosh, it was Clearway Energy, I think. But Black Rock Wind Farm is what it's called, and they're going to invest $200 million in our state. We embrace all forms of our energy. First and foremost, we love and we know that we absolutely have got to remember every single coal mine job is precious beyond belief. Every single gas job, the same thing. We got to keep those people working and grow those industries if we possibly can. But at the same time, we welcome the wind people and this wonderful, investment that they're making in West Virginia. It will be absolutely really substantial to the counties of Grant and Mineral counties. From the standpoint, we have a delegate appointment and everything, and that is Joshua Booth from from Canova. He is being appointed. I am making that appointment today. Mr. Booth replaces Delegate Derek Evans after his resignation earlier this month, and I feel very, very confident that Joshua Booth will do a wonderful job for the people of West Virginia. I've got two things real quick. One is this article, came out from CNN, where we were on CNN and we were talking about West Virginia, and Beatrice McPhillips did a marvelous job, and we appreciate CNN, and we've been on, MSNBC and CNBC and Fox and Squawk Box and a lot of places, and we've been telling our West Virginia story and just letting the people know out there just how good we are in West Virginia, how smart our people are, how dedicated as far as craftsmen and the 4 beautiful seasons that this beautiful state has to offer in so many different ways. The more that we tout our pond, the more people are going to come to our pond. But now, last thing I've got is about our food banks, and I forgot we were on Good Morning America this morning, so there's been a lot of places that I'm sure you've seen us and everything, and from the standpoint, I got to say this one thing real quick. I've told you this story before, but really, a lot of the reason that I'm here, a lot of the reason that I ran for office was just this. I love West Virginia. I love its people. And I felt like we were getting the short end of the stick all the time. But it was never more illustrated to me better than in the golf tournament at the Greenbrier way before I ever decided to run for office. An elderly man, and I'll never forget this ever in my life, I'd been on CBS, and I'd been on CBS telling everybody how great West Virginia and its people are. So all of a sudden, after that, I'm out just walking around, and here's a guy in the gallery, and he walks up to me, an older man. He grabbed my hands, both of my hands, and literally with tears running down his face, he said, "Mr. Justice, my name is Bob something or another," and I can't remember what he said. He said, "Mr. Justice, thank you for making me feel more proud about who I am as a West Virginian." Now, really and truly, that's what all of us should be doing. All of us should be doing that. Every last one of us should be making other West Virginians proud about who we are. Because you see, I believe we're the best. I just believe we're the best. We don't need to walk around with our heads down. We don't need to ever do that in West Virginia. And so, be proud. Be really proud. Let me end by just telling you this about our food banks. Today, I want to take a moment to recognize our West Virginia food banks. Since the beginning of the pandemic, the Facing Hunger Food Bank and the Mountaineer Food Bank collectively, now get this will blow you away. 2 food banks, the Facing Hunger Food Bank and the Mountaineer Food Bank, collectively distributed 34,326,242 pounds of food, resulting in 26,635,328 meals being provided to West Virginians across the state in all 55 counties. In a partnership with the West Virginia National Guard, over 1,800 food boxes were aggregated and distributed daily, every day, between the 2 food banks in an effort to address the growing demand for food due to the pandemic. Thousands of miles were logged as the food banks took their teams into communities all across West Virginia, providing over 518 mobile food distributions. The West Virginia National Guard also stepped up to help them create a hunger-free West Virginia center at their Rock Branch warehouse. We owe a huge, huge debt of gratitude, do we not, to our food banks and to our great National Guard. Our National Guard is unbelievable how they've stepped up. And now I want to welcome Cindy Kirkhart from the Facing Hunger Food Bank and Chad Morrison from the Mountaineer Food Bank to speak about these efforts. And thank y'all so much.
Thank you, Governor Justice. My goodness, we're so happy to have you share that information on our behalf. But what we really want to talk about, and I know Chad is joining me in this, is the important partnership that you've provided since the end of 2019 in being able to support the food banks and being able to make these great achievements in an incredible pandemic. General Hoyer and the team at the National Guard, it's taken all of us across the state. And so we're here to also pay homage to you and to thank you for your work.
Yep. Thank you. And I echo the same sentiments as Cindy. Your support and the support of the West Virginia legislature and really elevating the issue of hunger has been just a tremendous success for us. Of all the things that were not great about 2020, that was one thing to take away, that generating that conversation about hunger is a win for us coming out of the year. And even before pre-pandemic, 260,000 people struggling with hunger, and as you can imagine, many more struggling with hunger due to COVID-19. It's so important to keep this issue out there, and we just appreciate that support. We appreciate you, recognizing the food banks as part of the critical infrastructure of West Virginia and the work that we do here in the state.
Well, Chad and Cindy, you humble me, because I just thank you so much for what you do each and every day. I mean it from the bottom of my heart. I love you with all my soul, and I just think, it just absolutely just, it's not even fathomable how many people in West Virginia are still hungry. I mean, just think about it. How many people in West Virginia are still hungry? I mean, it's sad, but it's good what you're doing, and I love you with all my soul for doing it.
Well, Governor, we think a lot of you, and Chad and I were both so thrilled when you included the food banks in your State of the State address this past year. To Chad's point, the legislature backed your play, as it were, to see that for the first time the food banks received funding from the state. So we have a little surprise for you that I hope someone's going to present.
Oh gosh, no, what is this, y'all? I mean, y'all are too kind, way too kind. Thank you.
So you are the hunger hero for 2019 to 2020, helping us to achieve a hunger-free West Virginia. And on behalf of the team here at Facing Hunger, and I know Chad will have some things to say, we wanted to honor you and the work that you put into place to allow us to do the great work we've accomplished together this past year.
Yeah, absolutely. And the same sentiments from Mountaineer Food Bank, our staff, and I'm sure from all the hungry people here in West Virginia. We know that only when we all contribute and are a part of the solution. Can we end hunger? So we thank you for being a leader and a hero in that regards.
Well, Chad and Cindy, listen, I've been fortunate enough in my life to be blessed with a lot of things, but I will promise you this will never, ever, ever leave me. Forevermore, at any time that you were to come into my offices, no matter where they'd be, this will be there. And this is really big, big thing to me. God bless you in every way. Thank you so much, because this, I am so proud. Hunger Hero. That's really neat stuff to me. Thank you so much. Thank you.
All right, thank you, Governor. We'll now move on to panel. Let's first go today to Bill Crouch, Secretary of the West Virginia DHHR.
Good afternoon, everyone. It is with deep regret that I announced that DHHR has experienced the death of one of our team members. Theron Biddle has passed away from COVID-19. He was an accountant with DHHR since 2016 and a long-time state employee. Theron is survived by his wife of 36 years, Jane, and their daughter, Kendall, and their sons, Theron and John. Please join me in wishing this family our sincere condolences.
All right, thank you, Secretary. Next, we'll go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
Good afternoon. Just an editorial comment about what occurred a couple minutes ago there with the food bank and that piece. You know, as much, Governor, as I'm excited that we're getting all this national press on the great work that you're pushing us to do related to vaccines and that being the first to test nursing homes and being top in the nation in testing. I think a testament to what we've done and what you've led us to is we are doing an exceptional job of what we discussed at the very beginning of this pandemic, and that is taking care of West Virginians, whether it's those in need who need food or the way we handled the unemployment requirements for our citizens or all the other things that we're doing related to the hotline. We are doing our very best to take care of the citizens of West Virginia, and I'm exceptionally proud of that and the leadership and the work that's going on. I just want to highlight a couple of things. We continue to make great progress, as the governor pointed out, with distribution of first and second doses. As pointed out, we will get some additional allocation of the Moderna doses next week. I want to also make sure that people understand there seems to be a buzz going around on social media about concern that second doses will not be available. And that is absolutely incorrect. We are receiving the appropriate number of doses that we need to make sure that West Virginians who get the first dose get the second dose. So rest assured, we're working with our federal partners and we're managing the appropriate doses that we need to make sure that we take care of folks. In addition to that, also want to point out, let's don't lose sight that the Interagency Task Force working with DHHR, Department of Agriculture, Emergency Management, FEMA, and all the other agencies that are participating yesterday delivered to 77 locations PPE and supplies for vaccine distribution. We also are still 16th in the nation on the number of tests per 100 population. So a lot of work that continues to go on. Also want to make sure that folks understand if you have provided us a list in the past of individuals over the age of 50, essential workers, and others who need vaccines, that those lists are being worked by the DHHR IT team and are going to be merged into our process for making sure we get folks registered. So we continue to work hard and we'll continue to press to get vaccines in people quicker than anybody else out there. Thank you.
Thank you, sir. Next, we'll go to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. I do want to also send my condolences to the Biddle family from our department. My heart and prayers go out to them. We do also want to mention that we are seeing encouraging numbers of people signing up for the vaccines through our Everbridge system, so that's been working well. We do appreciate your patience with that. I do want to remind everyone that if you get vaccinated, you still need to wear your masks, so that is important. We are a couple weeks into this model, but we are going to be seeing community partnerships through each of our counties, as the governor and General Hoyer has mentioned. We do want to thank all our local health departments, community health centers, emergency managers, all the volunteers who's been helping us throughout these couple of weeks. It's been a hard year, but we see all the strong commitment and teamwork that everyone has been helping us. So we do appreciate your support. But thank you for everything. And we'll see the next couple of months hopefully get better. Thank you.
All right, thank you, Dr. Amjad. We'll now go to questions from members of the media. We have a national reporter joining us today, Evan Bednarski from CNN. So, Evan, go ahead.
Thank you, Nathan. Thank you, Governor. At the current juncture, does the state have a sufficient supply right now to continue inoculating at the rate they've been going? And is there thought to having to put some doses in reserve for second doses?
Eric, I think General Hoyer can answer this better than I, but I think the answer he's going to tell you is, as far as second doses, we continue to get our second doses, and we're very confident that we'll be able to handle that. But I think he can answer that better than I.
Yes, Eric, as the Governor Justice pointed out, we do not have an issue with receiving second doses. So we are working aggressively to put first doses in arms as quickly as we can get them out. Next week, we will establish across all 55 counties distribution capabilities that expands our ability to get doses in arms. We normally have been getting 23,600 doses a week. We'll get a slight increase next week to additional 3,700 we've been notified of so far, but the governor's objective would be, we want to and need to put a minimum of 125,000 doses a week in arms, and we are prepared to do that.
Back to me just one second. Was it Eric? Is that correct?
It's Evan.
Evan, I'm sorry. Evan, it's the governor again, but Evan, I do want you to know just this, that the doses that come in to us, as they come in on Monday and Tuesday, by Sunday evening, every week, West Virginia has repeatedly, over week after week, we have every single one of those doses in somebody's arm. And in addition to that, we're getting about 25,000 plus or minus doses in as far as first doses. As far as the second doses, we're using them as we get them in and everything, but everything's been right on schedule in regard to that. But Eric, Evan, I just said just a second ago, we're looking at getting 25,000 in. We have been the model state as far as being able to get doses in people's arms in every place imaginable in this state. Now, just think about it. Absolutely, our National Guard, our health department people, our vaccination clinics and our super hubs and everything that we're doing, pharmacies and everything, the all-in approach, without any question, today, if we had an unlimited supply of vaccines, it would make your head swim how fast that we could get every single person in the third oldest state, a state that has the most chronic illnesses of any state. We could get everybody 65 and older, and we could get shots in arms. We may not be able to accomplish it by February the 7th, but I'll promise you by Valentine's Day, they'd be all done. We just don't get the vaccines, and that's our big problem right now.
All right, thank you, Evan. Next, we'll go to David Beard with the Dominion Post.
Hi, a question was directed to our newsroom and passed to me. We were told that reader or readers who are in line to get the vaccine fairly soon were told their insurance would be billed for this. And I know the vaccine itself is free. The feds are paying for that. And I know that at least here at the big mega clinic at the old Sears at the mall, that's all free. But so I guess my question would be two parts. Who is charging for the vaccine? Is it local health departments or some local clinics? And what are legitimate charges they can pass along to the insurance? And I would suppose would all eventually fall on the patient themselves through their co-pays and out of pocket. Thanks.
Secretary Kraus, you've got to do this one, please.
A schedule of rates for first dose and second dose for administration. I believe the first dose is $18. The second dose, I believe, is $23 or $28. Don't hold me to that. But they may charge, insurance companies can be billed for those services, for those vaccination administration services. Pharmacies could do that as well. The vaccine itself is free. That is from the federal government. No one pays for the vaccine. So when we do clinics throughout the state, there is no charge for those clinics, much like the testing that we set up. The governor pushed us to make sure everybody had access to tests. And what he's saying now is everybody needs to have access to vaccinations as quickly as possible.
All right, thank you, David. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, Governor. You extended child care payments, I think, for the end of January for essential workers as they continue to work during the pandemic. But I've been contacted by a couple of companies and several parents and providers to ask if you're planning on extending that through the next month and the next several months, say to the end of June. They haven't heard anything, and as now we're arriving at the end of January, they're starting to get a little worried that that service to help pay for that daycare service won't be extended. Thank you.
No, Kenny, I think Secretary Kraus can follow up on this, but I think we've received an additional $65 million to be able to extend and everything. And Secretary Kraus, if you could just jump in, I think without question we're going to be extending. But go ahead, Secretary Kraus, please.
Yes, Governor, thank you. And at the governor's direction, we extended those payments and in hopes of getting that federal money. That federal money is coming into us, so we will continue those benefits to folks. We want to make sure that everybody has access to those services and who need those services. So the governor is right on target. We are continuing those. More information will come on that perhaps by Friday, no later than Monday. We'll be able to give you a little more information on that, Kenny. It's a good question. Everyone keeps asking, and we will continue those services. Thank you.
Thanks, Kenny. Next to Steve Adams with Ogden Newspapers.
Yeah, this is Steve Adams with Ogden Newspapers. The Wayne County Republican Executive Committee has a mandamus lawsuit against you in regards to them giving you 3 names to choose from, and then the state party dropping in Mr. Booth's name in replacement of one of the names that they had previously submitted. Can you address this controversy, please? Thank you.
Stephen, all I know from my general counsel and chief of staff is we've been in constant contact with the Attorney General's office, and we believe wholeheartedly that the second letter that was sent to us is the legitimate letter, and so you know, I think this will have to be handled by the lawyers and not by me, but that's about all I can give you right now.
All right, thanks, Stephen. Next to Brendan Tierney with WSAZ.
Hi, Governor. I have 2 questions today. First, for the governor, you talk about the White House doing more to get more doses, 3,700 more coming next week. And the fact that West Virginia is kind of leading the nation in getting shots in arms, what are you doing to communicate with the federal government saying that we need more doses here in West Virginia to reach that 120,000 mark that the National Guard can distribute? And also, I was hoping General Hoyer could talk a little bit about how that vaccination process is tracked. We found today that the DHHR doesn't track that on a county by county level. So I was hoping we could get some information about how it's tracked and how you're able to calculate the numbers of what percentage has actually been administered in different counties. Thank you.
Brendan, from the standpoint of, the first part of the first question, I can assure you that I'm talking to every single person that I can possibly talk to. And I'm sending every letter. I'm doing every single thing that I can possibly do, and pleading with our congressmen and congresswomen and our senators to try to help us any way that they possibly can. The fact is just this, Brendan. What happened is, just to tell it like it is, a lot of states couldn't figure out what to do. And all of a sudden, West Virginia did it. And now, most all the states are doing what we did right off the get-go. And so, with all of that, now you've got a situation to where states, whether they be New York or California or wherever it may be, all of a sudden, even though they are nowhere close to being ramped up like we are, they still see a tremendous need for even more and more and more vaccines. And so everybody's screaming the same thing. Send us more vaccines, send us more vaccines. We thought we were going to be tremendously rewarded for doing this unbelievable job. And you don't really have to be rewarded, but the reward that we were looking for was more vaccines. Well, they haven't come. They haven't come substantially at all. Now, I give the new administration, surely the kudos and the time and the respect over the fact that, when you got lots and lots and lots of people screaming, I'm sure they're trying to do the very best that they can possibly do. I absolutely believe that in a short order, production will move up and we'll be able to get more and more vaccines. But we have not been rewarded for all the great work we've done, except just one thing, and this is really the only thing that should matter, is by doing the great work and not leaving them in a warehouse somewhere, we've saved a bunch of lives. Now, maybe General Hoyer, you could answer the second part of the question. I don't know about the second part.
Yes, Governor. So as of February 1st, when we open up the facilities in all 55 counties, we will have a tracking of all 55 counties as it relates to that. If we needed to go back into the federal VAM system, I believe we could pull data by county, but that's significantly time intense based on the system that's structured right now. We do track where the doses go from the hubs to the various sites that they go to for final administration.
All right, thank you, Brendan. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. This is probably best answered by Secretary Crouch. I was wanting a little bit more information on the process of integrating all of our different vaccine lists, from the health departments, from WVU Medicine. How long will it be until we get it all down to one list? And how are we ensuring that during that integration process, nobody slips through the cracks? Thank you.
Secretary Crouch, go.
Yes, sir, Governor. Thank you, Charles. Good question. We are working on that now. We had meetings with local health folks. We have meetings scheduled, setting up with hospitals. We plan to merge all of those lists together and be operational with one list, probably February 8th. It's possible to go a little sooner, but we're looking at that week to have this all done and be able to use that list to actually set appointments. As you know, right now, the information goes two ways with this program. Individuals are notified that their information has been submitted and that they are registered. So We ask folks, please don't call the call line again to see if you're registered. If you get that notice back, you are registered. We are merging these lists in such a way that the priorities at the local level stay the priority at the local level. So no one will jump line on individuals. We get a lot of questions there as well. We want to make sure this goes smoothly. We're going to try to do it a little sooner. We're pretty sure we can have it by February 8th, and we'll provide updates on that probably Monday of next week or so. So good question. Thank you, Charles.
Yeah, thanks, Charles. Next, we'll go to June Leffler with West Virginia Public Broadcasting.
Sorry about that. So this is a question for Major General Hoyer. So there's been a little bit of national reporting around National Guards people that went to inauguration, and a lot of them ended up getting COVID. And there was an article by Politico that mentions West Virginia specifically. They don't name their source, but they say, about 150 plus West Virginia Guards people got COVID or were quarantining. Can you just tell us what we need to know about our folks that went there and how they're doing?
I'm not aware of the Politico article. I do know that at Governor Justice's direction, the West Virginia National Guard is testing all of the guardsmen who are coming back from the inaugural support and the support in DC. And I'm not aware of the specific information right now. You need to reach out to Brigadier General Crane and the Guard staff.
All right, next we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. This is not necessarily a COVID question. It's more of a change of administration questions. We all know President Trump was pretty big on coal in West Virginia, and President Biden is pretty big on climate change. Governor, can you reach out to the new administration to try to protect those coal jobs and maybe even fracking from regulation or over-regulation?
Paul, I can reach out, and I have reached out, and I'll continue to do that until God chooses to not give me breath anymore. Because I truly believe in our natural resources in this state. I hope and pray our congressmen and women and senators will help us in every way there. I guess time will tell. I really think that from the standpoint of just wisdom, we can't do without coal today, and we can't do without gas. There's just no way, no possible way. And everything, unless we are absolutely just driving the car right over the cliff, and it is impossible to do that today. Now, all of us want to try to embrace alternative energy sources and everything, and maybe, not in our lifetimes, but maybe someday there'll be the ability to transition away. But if we do that today, and we really think we're going to do that, we will have blackouts. We will drive up electricity costs to our people. We will absolutely have chaos on our hands. And I hope and pray that the Biden people, really know this, and I'm confident that they do, because I've got to be confident all the time that people are good, and they want goodness for our people and goodness for Americans. We have sent a letter, and we continue to have discussions and everything. And I think it's premature for us to to just run and dive in the ditch. You know, we have seen some positive movement in gas prices and metallurgical coal prices, and we hope for, you know, things will be better in the thermal business as well. But Paul, let me tell you this. I said this forever ago, and Bill Rainey and Chris Hamilton can attest to this, but you know, my dad died in 1993, and then shortly thereafter, I ended up being the secretary of the Mining and Reclamation Association, and then it was combined with the Coal Association. And then you move through the ranks, I think, secretary, treasurer, secretary, and then treasurer, and then vice president, and then you're president. And I was the chairman of the, you know, Coal Association to be, and at the time it was the West Virginia Reclamation and Mining Commission, you know, or association. In that, right off the get-go, I said over and over, West Virginians should be proud, so proud of who they are, a long, long time ago now, Paul, you know, and in that, basically what I was saying was West Virginia is a natural resource state. We should be proud of that. We should be proud of our coal miners and proud of our gas workers and all the people that are tied to those industries. Proud of them. You know, at the time I said, you know, if you go to Iowa City, Iowa, and you step out on the street and say you're a farmer, everybody respects an oil worker in Houston, Texas at the time. But when it really, really, really boils right down to it, West Virginia is moving in our economy is becoming more diversified, which we think is opportunity to us. But we shouldn't ever, ever, ever forget, really and truly, the heavy lifting that our coal miners have done for us, and now that our gas workers are doing for us. And we should not run off and leave, you know, and dive in the ditch the contribution that they're making to all of America and all the world each and every day.
All right, thank you. Paul, next to Mark Curtis with Nexstar Media.
Good afternoon, Governor and Cabinet members. And first of all, on behalf of our company, we offer our condolences to the DHHR employee who died. It just goes to show how dangerous this all is, especially for the frontline workers. And so our thoughts and prayers are with his family. We have been getting phone calls about this, people wondering, and I want to be sensitive and respectful in how I ask this question too, but it is a matter of public interest. People have asked, what building did this person work in? Is the building being sanitized? Is contact tracing being done? What is being done to protect the other DHHR workers in that facility so that this doesn't spread and happen to someone else?
Secretary Crouch, it's you, sir.
Yes, sir, Mark. It's a good question. That individual had not been in the office for some time. I don't have that date in front of me, but it was clearly not an issue where we needed to do anything with regard to this situation. But we do have instances and have had instances where we have had individuals who are positive, and in every instance that happens, we operate and function just like the private sector, and as we require everyone. And if that means closing an office or a suite of offices and having those offices deep cleaned and sanitized, we do that. We have folks who are constantly, I don't have a lot of people in this office right now, but we do have individuals who clean commonly used things like doorknobs and areas that people might touch. So we follow the same protocols and the same procedures that we require of others where there is a positive case. So, but it's a good question. We want to protect our employees, and we do. So thank you.
All right, thanks, Mark. Next question to Phil Kabler with the Charleston Gazette-Mail.
Hello, everybody. Kind of wish Dr. Marsh were here today. That I believe early in the month he had indicated that experts were expecting a post-Christmas, New Year's surge of cases beginning, I think it said about January 21st, we would start seeing another surge, which has not occurred either in the state or or nationally, as far as I can determine. Do we know why we didn't have a anticipated second surge or third surge post-holiday?
Dr. Amjad, I think it's you.
Sure. Well, Phil, those are just predictions, as everyone knows, and those were predictions actually given by the new CDC director and a lot of other experts. But I don't want to give anyone false information. We're still, not to be a pessimist, but we still want people to be vigilant. I do want to commend everyone in our state of West Virginia. We have been noticing a lot of people wearing masks more. We don't want to attribute it to the vaccinations necessarily because it's too early to tell, but we do think people are wearing masks more, doing socially distancing. But as a whole, especially with the new mutant strains across the country, we still need to be on our toes, so to speak, just in case. But we are surprised as well that we didn't see a bump in our numbers. But overall, I think our state has been doing really well with our hospital systems, our health departments, and everyone as a whole. But I think we need to also be vigilant and not take it for granted. Thanks.
All right, thanks, Phil. Governor, I'll turn it back to you.
Well, I'll end up pretty quickly today and everything, and again, I want everybody to remember in your thoughts, your prayers, the Biddle family and Theron. You know, I could surely tell by Secretary Crouch with big tears in his eyes and everything. Just this is it's a dreadful thing. This pandemic that just came from nowhere. It just it's just hard to fathom. 1,953 people. It's amazing. It is absolutely really sad. So remember them all. Remember Theron. Remember them all, and keep them in your prayers. And I want to especially again thank Cindy and Chad and our great food banks and all the great work they've done. You know, they've given me something here that I'll cherish and keep with me forever. So thank you, and just hang in there, West Virginia. We're getting there. We're going to win this battle. That's all there is to it. We're not far now. Just hang in there. Thank you so much.